This video demonstrates an ultrasound-guided puncture of an incompletely deflated balloon following central venous angioplasty for a subclavian in-stent stenosis in a patient who presented with gradually worsening right upper extremity swelling. Ultrasound imaging was used to identify a patent fistula. The fistula was accessed using a micropuncture needle and wire, followed by a micropuncture sheath. Initial injection showed subclavian vein in-stent stenosis. Next, a glide wire was then passed through the micropuncture sheath and an 8 French sheath was placed in the axis. Subsequently, a 14 mm balloon was then inserted via the sheath and SVC angioplasty was then performed. The balloon was then positioned in the noted area of in-stent stenosis and inflated as seen in this portion of the video. Here we can see that unfortunately we were not able to retrieve the balloon through the sheath as the tip would not completely deflate. An empty syringe was connected to the balloon inflation port and negative pressure was applied to help deflate the balloon, but that didn't work either. Therefore, the balloon position was accurately determined using a combination of fluoroscopy and ultrasound imaging. Using ultrasound, we accessed the tip of the balloon using a micropuncture needle and aspirated the contrast, allowing for complete deflation of the balloon as seen in this portion of the video. Repeat angiography revealed complete resolution of the stenosis. The sheath was then withdrawn and manual pressure was held until hemostasis was achieved. Lastly, a sterile dressing was applied.